Hello, my name is Dale Wilhite. I'm right now living in Alpine, Wyoming. If you want to find out anything about me, go to MySpace, Facebook, or Twitter, where I have accounts. Anyhow, this has something to do with the healthcare, a new idea that I have that's really maybe not an old idea, but something that we used to do here in America, back in the 1800s particularly. And that is where doctors back in those days, especially in the rural areas, way out in the country areas, you know, when they treated their patients, they didn't always get financial uh, compensation. Sometimes they would get maybe extra food, maybe something material, maybe something to a window or something like that. And these country doctors back in those days were not exactly paid very well because people back in those days didn't, have that kind of money like they have now. Even poor people today are considered rich compared to what people, were like had to live and exist in those days. And if you remember the television show Little House on the Prairie, remember the character Doc Baker? The actor that played that, of course, betrayed Doc Baker has passed away, sadly. But if you remember, the way he was paid was people were giving him chickens and material things sometimes. That was the only way they could pay him because they just didn't have any money. Well, here is my idea about how we can go back to doing that in a certain way. Not in the exact way, of course, but in a certain way. And this could be something that could really help bring about more physicians because we're going to have a big shortage soon with this healthcare bill or law because if it isn't struck down, we're going to be in a lot of trouble soon. And you talk about long waiting lines, you're going to be in a long waiting line soon. And if you're pretty old and you need certain medicine stuff, you're just not going to get it because they will deny you certain medicine if they think it's just too expensive. They do that in Canada all the time. Anyhow, why doesn't our government, although I would prefer the states to do this, I'm not too crazy about the federal government right now, but why not, let's say the states do this, why don't they take the money if they have it, or when they have it, and send a lot of physicians or students who want to be physicians and qualify to be physicians, and obviously they can pass and be good, and have them go to school to become physicians. And why not set up hospitals, clinics, more like clinics, I would say. And these would be where people visit a physician. These are not emergency room doctors, of course. And they're treated. And the patient has the option, and these are patients without insurance, of paying whatever they think it's worth. Now, there's some people who will cheat the system, never pay a dime. But there are those who have a conscience who will try to pay something. These physicians exist solely on the goodness, I would say, of their patients, who will make every effort to pay them what they can. The government could probably make sure that these physicians have a place to live. That would be, I would still prefer it be state by state. Let the state governments handle something like this, not the federal government. They'll screw it up. And make sure that they have the materials, the medicine, stuff like that. But remember, these are going to be physicians who are not, doing surgery or anything. These are just basically your family doctor. And let the patient pay what they can. Now, these are those without insurance, is what I'm referring to. And it's up to that physician whether to accept it. Let's say this physician has a truck. Or excuse me, a patient has a truck that can give the physician for something that was, an old truck or something. Physician say, yeah, I'll take it. Things like that. You should get where I'm going to here. It's not going to be a perfect system. As I said, there will be people who would cheat. But why not give it a try? You see, just having the government pay for everything and paying these outrageous prices, for seeing a doctor, we're forgetting about where we came from. And we need to go back in time a little bit. And I believe you will find physicians or students who would be willing to live like this. It wouldn't be maybe for life. It might be for 6 years. They're willing to work in such a place where they are dependent on their patients to pay them whatever they can or whatever they think it's worth. Do you see where I'm coming from? It's worth a try. again, I still think the states would be better off doing this, not the federal government. And that's because this is more of a local issue. And a state governor and a state legislator knows the kind of people that's in their state. They know where these type of clinics could be set up, and they can handle it a whole lot better, more locally than federally. So it's just a thought, you know. And again, there would be, I'm sure procedures to make sure that this physician doesn't end up homeless or broke and can't pay his or her bills. What I'm modeling part of this after is after the military. You know, if I had the qualification to be a physician and was young enough, I'm not young enough, of course, anymore, and I qualified, didn't have the money to go to college to be a physician, well, the Uncle Sam will come in and pay for my education as long as I serve 6 years in the Army, Navy, Marines, or Air Force. And then after the 6 years, I can go out and open up my own practice. That's why you don't see many physicians in the military that have gray hair, because most of them get out after 6 years. But, that's okay. That's what they want to do, and that was the agreement. That's what the contract states. That's kind of the same thing here. If you can find, and I think you will, people who want to be physicians, willing to serve and accept whatever their patients will pay them or offer them. And of course, there will be guidelines to make sure this thing doesn't get out of hand and it doesn't get ridiculous. I still say that some people will pay what they can, and some will be honest. Of course, now keep in mind that physician may also receive patients that have insurance. So that may be what is needed to make sure that this physician doesn't go broke or doesn't end up homeless somewhere, or just nowhere to live, or has to live in a, his car or something, or van. So, I think you could still do that. But that would be an idea. Let's give it a try. If you like the idea, please pitch this concept to your political representative. Put it into the newspaper in the letter to the editor section or whatever. It might work. Get the idea out, and let's see if some way, somehow, somebody up top will hear about it and maybe say, hey, let's give it a shot. Let's try. If you really care about poor people, and if they care about poor people, why not give it a shot? Again, let the states handle this, not the federal government. It's just an idea. I thought I would pitch it, and thank you for your time.